All right. Well, I'm glad we get the opportunity to talk about parathyroid disease. I know you talk about so many different things on your TikTok channel, but since you have direct experience with all this, I think it's great for everybody.
Yeah,
So
for sure.
there's a lot of different things to talk about, and parathyroid disease, it's so variable, not just in the anatomy, but the way it makes people feel. So I'm curious, what was your experience like with the symptoms? Because there's so many different ways that this goes.
Yeah, so it wasn't until Black Friday 2020 that I got COVID actually. And the normal symptoms that you get of the Delta variant of COVID, with the no taste, no smell, fatigue, brain fog.
Mhm.
But then after
Yeah.
2 weeks, that brain fog and fatigue didn't go away, even though
Mhm.
I like started smelling and everything came back. And I remember going back to work and doing like I was a microbiologist, but it was a simple task. Like once you were trained on it, you should be able to do, but it was like a time limit thing. And
Yeah.
I barely hit that time limit to be able to like finish the test, needed a lot of help. And I was just like, I can't do this.
Yeah.
And I thought I
This
had long
isn't me.
COVID for a while. Yeah. But then the symptoms just like kept happening, and things like other things started happening too. Like I started like drinking a ton of water, peeing a lot. um
That's a classic. Yeah.
I remember I got more kidney stones, and weird, like I guess bone pain is what it was, just like in the feet and the hands.
Yeah.
And it was like, what's going on? So I thought maybe it was actually my thyroid, because nobody
Mhm.
knows about the parathyroid, right?
Mhm. Mhm.
And saw an endocrinologist, and she ran just like a ton of blood work on me, just to rule out things too. Like I remember she even ran like adrenal tests, but the calcium was really really high in my blood, and so that was like the first indicator, I guess, of parathyroid disease.
Yeah.
Yeah, yeah. I remember actually even, being disappointed with my blood, test results, when they came back, because my
Yeah.
thyroid was perfect, and I was like, "No, but something's wrong," like
Something's wrong.
but, then I ended up, like, Googling, like, what happens with high calcium in the blood, and, that kinda stuff, and stumbled upon parathyroid disease.
So your you saw the endocrinologist thinking it was low thyroid, who
Yeah.
noticed the high calcium. Did they talk to you about hyperparathyroidism at that time, or was it really just
So
you doing your own research?
Yeah. Well, so she, meanwhile, like while I was doing my own research, because I was freaking out, like there has to be something wrong. Um, she ended up sending more like tests, I guess, for PDH and calcium, and
Mhm. Mhm.
all of the stuff you normally would test for with parathyroid disease.
Yeah.
And so we were waiting like those results, but like in that meantime, I was like looking up like parathyroid disease.
Yeah.
So
That that's not uncommon. It's usually the steps of the doctors notice high calcium, patient
yeah,
starts reading about high calcium, and then the next step is getting the PTH. So by the time you get that many, people are kind of familiar.
yeah,
Um, and it's interesting the way you describe having a different illness and then not recovering from that illness, and realizing that something else must be going on and chasing it is very common. Because most people with hyperparathyroidism, they have symptoms and problems. They don't come on all at once. It's
hmm
like a little bit at a time for years, and it just builds up until they hit a breaking point. And for many
okay,
patients, it's a trip to the ICU for another illness. It's
hmm
some other problem that happens that's the breaking point. And then afterwards, they realize something is really wrong. I didn't recover from fill in the blank the way I should have. And I'm left with all these symptoms. And then sometimes they realize, you know what, I've been dealing with these symptoms for years. So I'm curious,
yeah.
in retrospect, after you got the diagnosis, did you realize looking back, it was long before my bout of COVID that I was dealing with these things? How far back did it go?
Yeah, so, and it was interesting, of course, the more you delve down the research, way, like, you start coming with, like, more medical journals that you read and everything else, and I'm like, "Oh my god, that's me." Um,
The deep
but,
rabbit hole, yeah. Yeah.
I have one son, he's 4, and,
Congrats. Yeah.
I yeah, and, when I was pregnant with him, there were, like, no pregnancy issues, like, ran in my family or anything like that, but at 24 weeks, I had to go in the hospital on bed rest, because my son had, like,
That's
severe
good.
growth restriction,
Yeah.
and I was on that bed rest in the hospital for 10 weeks till I had him, like, via emergency C-section. He was in the NICU for a while. 34-weeker, 2-pound, 6-ounce baby, like tiny. And then like 6 weeks after I had him, I had like a really, really bad kidney stone, first kidney stone. And I had to go to the ER like twice just because of the pain, and I was vomiting. So stuff like that, you know, like, and I was always wondering like, okay, why was my son, you know, have this IUGR? And then I stumbled upon this article that stated that like 80% of like fetuses in from moms that have like hyperparathyroidism, you know, have this chance of having like IUGR and premature birth and all this stuff. And it makes sense because they did find like maternal blood in the placenta. So if that maternal blood was calcifying, I'm sure that the placenta wasn't working that great, you know. It's just crazy stuff.
Yeah, and the problem is, I'm sure at the time when you were going through all that, you're focused on your kid, you're focused on
Yeah.
your difficult pregnancy, and you're so focused on the symptoms and problems you're experiencing, it's very hard to step back and figure out, well, what might be underlying all of this. And
Right.
that happens to patients and it happens to doctors too. We get so focused on what's the problem in front of our face and how do we feel better ourselves or help our patients feel better. Sometimes it takes a little time before people figure out there's something underlying that's connecting all of these problems.
Yeah.
And,
Yeah.
you know, what you were experiencing, kidney stones, IUGR, you probably had high blood pressure during pregnancy as well. I'm guessing because that's a common
Yeah. I was
one with
borderline.
parathyroid
Yeah.
disease and IUGR. These are common issues with hyperparathyroidism, but if nobody thinks about it,
Hmm.
you'll never find it. And it's only in retrospect, you're like, oh my goodness, it was there the whole time.
Yeah.
And that's a common experience.
For sure. For sure.
Well, I'm sorry you went through all that with your kid. It's very scary, but 4 years old, that's wonderful. So
Yeah. Yeah.
I'm
He's
glad,
doing great
I'm glad
now.
to hear it. That's fantastic. I'm glad to hear that. So you realize this has been going on for a long time. You finally have a diagnosis. Most people, you know, you'd think it'd be terrible to get some medical diagnosis, but for many people, it's a relief to have an explanation that makes
Yeah.
sense of their world. So what made you to make the decision to come see us at the Norman Parathyroid Center to get this taken care of? What was the thought process or what were you feeling? What'd you go through?
So, a couple of things. First of all, when I was like Googling parathyroid disease, all the information kind of came up on parathyroid.com, which is Norman Parathyroid Center's website. So much, just a wealth of information really, about it, as well as like where to go, like what kind of surgeon you want for this, you know, to get rid of the parathyroid that's causing the
Mhm.
issue. And then I also joined a Facebook support group on hyperparathyroidism, and they listed Norman Parathyroid Center as well as a few other places, and just like what you want to look for, and it just mirrored exactly what I had already researched with, you know, NPC.
Yeah, well, it's nice because back in the day, the way people found their doctors was by a referral from a doctor they already knew. And so the self-referral rates were very low. But
Yeah.
nowadays, because people, you know, it's not just what people read from a professional center, it's what people read from past patients, you know, other businesses,
Hmm.
it's other customers. And in medicine, it's, well, what did people go through? And those stories are what make people feel comfortable that,
Right.
you know, this is something tangible, they can relate to it, they can go through it. And one of the big hurdles for people is the idea of traveling for medical issues.
Yeah.
And it's a big anxiety that people are going to go somewhere new. And we have patients come see us who've never been on a plane before, and
Mhm.
so there's a lot of issues that come up. So I'm curious, I know you had to travel. What was that experience like, and putting it all together to come down here, the logistics side of it?
Yeah, so first, like, I definitely wanted to go with somebody, so just like finding somebody, but it was hard, but I was glad my brother was able to come with.
It makes it way
Um,
better. Absolutely.
yeah. And then, but I, you know, honestly am super lucky for a really supportive family. My husband's, because she's his stepmother, his dad got remarried, you know, later on. And she had Hilton points, so she let us use those. So that was
Nice.
awesome. Yeah.
Yeah.
Norman Parathyroid Center too, like had listed a ton of hotels and places. So that was like super helpful to
Yeah.
know exactly where, because I've never been to Tampa, you know. Um,
Yeah.
and so our hotel was like 12 minutes away from the hospital, which was really pretty great. My brother wanted to like rent a car, so he did. So that was super easy as far as transportation goes and everything like that. It actually went really smooth.
Well, I'm glad you I'm glad you had some family support. You know,
Yeah.
some people come alone, and that's just tougher on them. It's obviously people want to get it done however they can get it done, but if you have support from family, it just makes everything so much more
Yeah.
comfortable and relaxed. And you talked about sort of reading about things beforehand, and we recognize most people have never even heard of a parathyroid gland before they get the diagnosis of hyperparathyroidism.
Right.
And most of people have never been to Tampa, and so they don't know what it's like. And so our goal is to try and help people become familiar with the process before they ever go through the process, so that when they finally show up, it feels like, oh, this is what I expected. And so I'm
Right.
sure you got a list of hotels from Angie, and those are the list. It's funny, people ask, how do we choose the hotels? It's very simple. They have
Yeah.
managers there who have a track history of being nice to our patients. That's it. If they get calls from patients who need a little extra TLC, they help them out, and then we hear about that. Those are the hotels. So I'm glad you had a good experience with that, because I know that makes people nervous. But the other big one is, what is it like to go through the surgery itself? And so,
Yeah.
what was your surgery experience like, since that's sort of the big moment?
Yeah. Yeah, well, I was surprised how fast, like, paced everything, like, moved. It was great. Like, I didn't have to wait for anything. Like, even registration, quick, got me in, and then going on over to pre-op and everything like that. I mean, I was familiar a little bit with hospitals and that kind of
Mhm.
thing from,
Yeah,
my
yeah,
pregnancy and everything like that. But
yeah.
it definitely everybody was so nice, which was great. Like very, very friendly, and I'm kind of an introvert, so it was great to have people that were,
It
like,
says
really
the
friendly.
TikTok personality.
Yeah, yeah. Um,
Introvert in different settings. Yeah.
yeah, yeah. I know.
I know it was new. You're walking into a new place, so it can be a little overwhelming.
Yeah, yeah, but it was nice. It was, like, I think the thing that just felt like the longest was the scan that they did, but even then, the radiologist, he was super great. So
Well, we're really lucky. We've had a dream for years now. I think it's been 5, 6 years in the planning to open the new hospital, and it was a nice opportunity for us, because in a normal place where you work, if you want something done, there's competition between all these different services and all their different needs. But where
Sure.
we are, the whole concept is, what's the patient experience? What are they going through? And then how can we design it? So it's funny, you walk into the hospital, I'm sure you saw, there's like the lobby right there. And then just
Yeah.
behind it are the locker rooms for the staff. And then just behind that, the pre-op area and the OR space, it's all right there. And the radiology is just, it's around the corner. So
Yeah.
we tried to design it so that it just made everything more efficient and comfortable for the patients and the staff, kind of all working together. And you were one of the first patients at that new hospital. We've been
Yeah.
planning and designing and dreaming about this for years, and now we're super excited to be there. It's for
Yeah.
me, it's a dream come true. I love working there. So I'm just curious, what was your impression, experience being at the new hospital? Because we're still learning what people think and what they're going through there.
Well, the waiting area, the lobby is, like, gorgeous. I was actually kinda disappointed in my brother because he wanted to just go he just went straight back to the hotel, and then we had to call him later, but I'm like, "It's so pretty." Um, like, it definitely feels kinda like you're, like I don't know, it has sort of a spa feeling, I think, to me, the lobby. But,
Parathyroid spa. I like that.
yeah. But yeah, it was nice. I mean, definitely the way you described it, yeah, everything is like so close, which I probably adds to like the speed of just everything. Just you didn't have to wait for anything, which was awesome.
Yeah, it's funny. I sometimes people say, it seems so quick and efficient here. I'm saying we love it that way, because it gives us time to talk to people and make adjustments. Because for
Yeah.
most people, it's a simple surgery, it's easy in and out, and things go quickly. But we have patients who have unusual situations. They've got tumors in their chest. They have
Mhm.
bizarre anatomy that was unexpected. They have other conditions that we discover, and we need to make adjustments. And if everything else is running efficiently, you can move those patients around, put them in different operating rooms, adjust so that if people need a whole extra conversation that takes you 45 minutes, you can do it. If you're always behind the 8 ball running all over the place, then
Right.
it's hard to have that extra time. And it's one of the things I love being there, that if I need to have a 15-minute conversation with a patient, that's fine. But if they have something strange going on and I need to sit down with them for 45 minutes, I can't. And that's rare in medicine. And it's
Yeah.
really great. So I'm glad you had I'm glad you had a good experience. I'm glad you sort of felt that efficiency, because we've talked about it a lot. How do we shape a patient experience and make adjustments based on what people need?
Sure.
So
Yeah.
I'm glad it was good. And now that you went through all the stressful stuff, the fun part is actually the recovery and getting to see, well, what was parathyroid disease actually doing to me? Because there's so many different patient
Right.
experiences. You never know what it's doing to your life until it's cured and some of those things go away. So what was the recovery like? What changed? How do you feel it's different?
Yeah, well, I was first of all surprised, like, pain was little to none. I think I took, Tylenol for maybe the first 2 days, and then I was like, "I don't need this anymore."
Good.
The next day, I was
Good.
walking on the beach,
Good.
so that part was all great, but I will say, like, it is definitely one of those things, it's not gonna be perfect the next day or maybe even the next week, my biggest struggle, I think, was the fatigue, and it was so debilitating, before surgery. Like, I would wake up exhausted and be exhausted
Yep.
all day. Now I don't wake up exhausted anymore. I feel like I wake up refreshed like a normal person does.
Mhm.
But, I still sometimes hit that wall of fatigue, and it might be 6 hours later, or whatever it is, and I have to sit down and rest, and that's really hard with a 4-year-old, but, um, I'm noticing those changes though, like, pretty consistently as, time goes on. So, that part's been great. I don't have to pee, and drink a ton of water all the time, so that's
Yeah.
great.
Yeah. That's very
Yeah.
common. Yeah.
And, and I think and the bone pain's been gone, since surgery, so that part's been great, but, yeah.
Well,
I
it's
feel
funny.
hopeful.
I think you have a lot to be hopeful for. It's funny, you had a lot of the classic symptoms that people have. And a lot of times doctors get hung up on things like kidney stones and osteoporosis. But if we look at quality of life studies for patients with parathyroid disease, it's always fatigue and brain fog that are the things that they
Mhm.
talk about all the time. Because it's fatigue doesn't sound like much to a doctor, but to patients, it's debilitating. If you're
Yeah,
tired all the time and you don't want to go do things, it really impacts your quality of life far more than a kidney stone. And
definitely, definitely.
so, one of the things I talk to patients about a lot is one of the symptoms of this disease that people don't think about is a loss of interest in hobbies, activities, and loved ones. And
Mm,
so, people have to force themselves oftentimes with this disease to engage in the things that really enrich their life. And when this disease goes
yes.
on for years, you make adjustments, you accommodate to it, you get used to kind of staying home more, doing a little less, and
Mhm.
having to summon up the energy to do the things you should want to do. And so people lose hobbies. And one of my
Mhm.
favorite pictures I ever got from a patient was he used to work on classic cars, and he just quit 5 years before his surgery and never knew why. And two cars were just sitting rotting in his garage.
Oof.
And a week or two after his surgery, his wife sent me a picture of his feet sticking out from underneath the
Aw.
bed, because he like rediscovered, hey, you know what? I've always loved this. It's just that the
Right?
tumor took away the joy, and with the tumor
Yes.
gone, the joy is back. So I tell my
Yes.
patients all the time, go experiment. Try things that you used to love that you don't love anymore, because it might just be the tumor taking that away from you. So I'm curious,
Yeah.
what are you looking forward to? What are you hopeful for? Because you mentioned hope. Like, what are the things that you want to do differently now that this is behind
So, definitely having that energy to be able to keep up with my 4-year-old before surgery, definitely, I didn't have that energy, and I felt so bad. There'd be times where I'd be just crying because I want
you?
him to have a fun mom,
Yeah,
But, we
yeah.
do a lot of things outside. We hike a lot, since we have woods in our backyard, and, just being able to, like, do that with him,
Mhm.
yeah.
It's a different parent. Everybody wants to do right by their kids, and we
Yeah,
force ourselves to do what we need to do. But it is different when you're excited about being up for those things.
for
It's way
sure.
better.
Yeah.
So I know what you mean. I've got a 3-year-old at home, so I know what you mean. So now that you've learned all this stuff, like most patients, you started from zero, probably didn't even know what a parathyroid was, hoping you had thyroid disease. And
Yeah.
now you've kind of been through the whole experience of all this. So what advice would you give for people who are just figuring out that they're at the beginning of this journey and they're trying to figure out what to do and how to approach it?
I mean, the biggest thing, at least for me, all the like symptoms of parathyroid disease, they're so subtle, and it would be so easy for me to just chalk it up to long COVID, but
Yeah. Or
the
being
at
a
the end of the
mom or
day,
being stressed or, you know,
yeah. But it's not just that, if you have fatigue for 2 weeks, maybe it's the flu or something, but if it keeps lingering, I mean, I'm 32 years old, I shouldn't be feeling that fatigue. I shouldn't be feeling that brain fog and forgetting things. I'm not old, like that's not normal. So,
yeah.
I mean, the biggest thing is, fight for yourself, be your biggest advocate and figure it out, and then, you can go from there once you get the proper diagnosis.
I love that you said that because a lot of people write off the symptoms themselves because they do come on so gradually, and then it
Yeah.
makes them susceptible to allowing physicians write them off as well.
Yeah.
And I say it's unfortunate, but if you go to a doctor and you say I'm tired and I have difficulty concentrating, if you're a young person, they tell you you're doing too much. And
Right.
if you're an old person, they tell you you're old. So
Yeah.
you can always write those symptoms off. Yeah, there's always a way to say I'm too busy and I'm aging. But the reality is, it doesn't matter what age you are or what you're doing with your life. You deserve to feel good. There are
Yeah.
people out there who feel good despite having full lives. So
Yeah.
if you have symptoms, you might as well try to get to the bottom of them. And
Yeah.
for parathyroid disease, you're absolutely right. You have to be your own advocate. Our average patient has this diagnosis for 5 to 7 years before they ever get diagnosed. And you obviously went through a long time and a lot of medical issues before it finally got figured out. So I
Yeah.
really appreciate you for spreading the word and talking about it, because we doctors can say whatever we want, but it doesn't nearly have the impact of patients who are confused and uncertain. And then they hear somebody talk about it who's been through it, because then they see themselves in what that patient is going through. Because all the symptoms you listed, some of them are in the top 5 of what people go through. So you've kind
Yeah.
of been through it, and there's other people who hear your story like, oh my God, that's me. So
Right.
and I don't know how many followers you have, but one of the things people don't understand about parathyroid disease is the Cleveland Clinic did a study, and a good friend of mine found that 0.67% of all people who got their labs checked at the Cleveland Clinic had primary hyperparathyroidism, which doesn't
Wow.
sound like a high percent, but if you think about
Yeah.
it in terms of population dynamics and how many people are going to watch your videos, it means guaranteed there's a bunch of people watching your videos that have this disease and they don't even know it. So I appreciate you.
Yeah, well, I appreciate doing it, for sure. Definitely spreading the disease. And speaking of that, I was wondering if you could give some sort of statistics on one, like how many people, just in the general population of people, probably have parathyroid disease, but also how many people in like maybe the childbearing years also have parathyroid disease, and if you think it's like underdiagnosed or if it's an
So
accurate statistic.
yeah, so it is massively underdiagnosed. Although most people with this disease are women who are in their 50s
Mhm.
and older. Unfortunately, that's a pigeonhole, and
Mhm.
docs get focused on that. We operate on men all the time, and I've operated on multiple pregnant women in my life, and also had multiple pregnant women who weren't candidates for surgery who waited till after. So if you look at population dynamics, the big one is the one I told you, the
Yeah.
0.67% of anyone who has labs, which is probably the best population study that I've seen, because there are other population studies that are hard to do to figure out the biases.
Yeah.
The other one that was an amazing study that shocked me was actually an autopsy study, because we know this disease is underdiagnosed and
Mhm.
undertreated. So somebody got the genius idea of just looking at autopsies and looking at the parathyroid glands. And they discovered that between 1 and 2% of people had abnormal parathyroid glands in terms of, characteristics looking like a tumor or something that might cause disease. The problem is we don't know what those people's labs and clinical findings
Right.
were. But
Sure.
if the Cleveland Clinic study shows 0.67%, and the autopsy studies shows about 1% or so, that gives us
Right.
an idea of what we're looking at.
Yeah. Interesting.
And the Medicare did a study, and they looked at how many people with this diagnosis who have Medicare get surgery, and it was only a
Okay.
third.
Wow.
So if you think about the fact that most people with this disease don't know they have it,
Right.
and on top of that, once they get a diagnosis, only a third of them are going to make it to the operating room. It gives you a sense of scale for cities of a few million people, how many people are suffering from this disease. And one of the biggest problems is a lot of the symptoms that women go through with this disease get overlooked when they're going through pregnancy. If you're pregnant and you have high blood pressure, you're probably going to get told you have preeclampsia. If you're pregnant and you're tired, you're probably going to get told you're pregnant. These are the ways these things get written off. And a lot of times the labs of pregnant women are a little different than non-pregnant women. So sometimes subtle abnormalities are ignored. And calcium is one of those things that if it's in the mid tens, you probably got a problem. And I've seen a number of my pregnant patients, those calciums were overlooked until someone familiar said, you know what, she's pregnant, but she's not an alien. Her calcium levels shouldn't be this high. We can't, and then they investigate it and they discover it. But if you don't think about it, you won't find it. So most pregnant women with this disease don't know it. And I've seen some bad cases in my times where women had multiple miscarriages until they finally had their diagnosis. And they were, once cured, were able to have their kids. So it's a big problem.
Yeah, for sure. All right. Well, thank you so much for this opportunity to come on too.
Well, it was a lot of fun. I'm glad we got to talk, and I wish you all the best with the 4-year-old. I'm glad you're feeling better. That's fantastic.
Yeah, for sure.